और अब वक्त है योर हेल्थ काउंटर का, जिसका विषय है प्रायोरिटाइजिंग एडोलेसेंट हेल्थ इन पोस्ट कोविड टाइम्स। इस विषय पर बात करने के लिए हमारे साथ हैं डॉक्टर हेमा दिवाकर। डॉक्टर हेमा इंडिया की लीडिंग गायनेकोलॉजिस्ट में से हैं, जो बेंगलुरु के दिवाकर हॉस्पिटल में प्रैक्टिस करती हैं। देश विदेश में इनका बड़ा स्थान है। वह ऑब्स्टेट्रिक्स एंड गायनोलॉजिकल सोसाइटी ऑफ इंडिया के फेडरेशन की अध्यक्ष भी हैं। डॉक्टर हेमा दिवाकर इंस्टीट्यूट ऑफ पब्लिक हेल्थ से जुड़ी हैं, उसमें टेक्निकल एक्सपर्ट भी हैं, जो भारत सरकार की एक इनिशिएटिव है। मिस्टर शंकर बात करेंगे हेमा दिवाकर जी से। मिस्टर आर शंकर हील फाउंडेशन के प्रेसिडेंट हैं। उनका जर्नलिज्म में 3 दशक से ज्यादा का अनुभव है। वे अब तक हेल्थ राइटर्स के 200 वर्कशॉप और 7 नेशनल हेल्थ राइटर्स एंड एडिटर्स कन्वेंशन का आयोजन पिछले 5 साल में कर चुके हैं। मिस्टर शंकर कर्नाटका और केरला से प्रकाशित न्यू इंडियन एक्सप्रेस के रेजिडेंट एडिटर रह चुके हैं।
The topic is prioritizing adolescent health in post-COVID times. Can you distinguish the health issues in adolescents before COVID, during COVID, and after COVID? What are the differences that adolescents went through this critical phase of 2 years?
When we say post-COVID, I think a lot of things that were always existing and always needed our attention were in the backyard, and the COVID has brought it and slammed it on our face, so to say. So we recognize the importance of so many things that we ought to have done at the appropriate times, because for adolescents, as the adage goes, you reap as you sow. So you sow the seeds of good health in them, preventive care in them, then they grow up into fine, healthy individuals, which make a healthy country. So the pre and post-COVID has allowed us to make this distinction of really recognizing the importance of health as well. And to my mind, the 5-point program that we always ought to have initiated for the adolescents, catch them young. That is actually the mantra. So the 5 things, one which COVID has brought to the forefront is for all age groups about nutrition and building up your immunity. So the right nutrition, especially in the adolescents, in the growing up years, avoiding anemia and stunted growth, that's one of the prime crucial things. The second is, so the lifestyle changes, inculcation of the habit of exercise and doing away with the sedentary life pattern and diminishing the incidence of obesity. That's the second important thing. The third thing is, for girls, what happens, especially in adolescence, is the onset of menstruation. Of course, the other secondary sexual changes do happen and happens by default, but one thing that strikes everybody's eyes is the menstruation. So menstrual health and hygiene forms the third important prong. And the fourth is all about vaccines. COVID has brought the vaccine to the forefront, which has made us reflect, well, there are many other vaccines beyond the COVID vaccines, which our adolescents should have got, especially the girls with respect to cancer cervix, the HPV vaccines, etc. So more attention and more focus is now getting on to that. The life skills and the awareness about sexuality, the sexual behavior, contraception, and mental health. So these 5 points, if you really focus, pay attention to something to make an impact, I think the entire phase of the health of the country as such will change with respect to the next generations. The key is the adolescent care, to build up a good foundation for the future. Don't miss the bus is what we always say. Act at the right time for a better yield, a better impact, and a better tomorrow.
Teen and child marriages became rampant during the COVID lockdown, especially in rural areas. Exodus of migrant workers from big cities and towns, their struggle for livelihood, protracted closure of schools, and anxiety in poor communities about their children's immediate future were among the most contributing factors that led to child marriages. And since attendance in marriage functions was restricted to 20 or less, parents could hoodwink the law. Now, what are the health issues that these unfortunate girls would face post-COVID, and what are the remedies?
See, actually, as medical professionals, we often tend to ignore the societal structure and the cultural backgrounds. For us, oftentimes, maybe because of the volumes, maybe because of busy schedules, maybe because we're so engulfed in managing complications, etc., these social fiber and what impact it may have about the girls' and women's health often gets ignored. And especially in low middle income countries like India, the rural, where the girls and the women themselves are not empowered to make their own decisions. So anything else that comes their way, they have to quietly accept it. So having said that, yes, everything has escalated. Everything that is wrong has escalated during COVID times, inclusive of the 30-35% increase in stress and mental health disorders, and so many people needing the psychiatrist's visit and psychological counseling, but also quietly, secretively, as you said, the early marriages. Why have we brought in a law for the minimal age of marriage? Because it has huge implications, and the school dropouts, when it happens, even in the yesteryears, we had recognized that unless the girl continues her education beyond the 10th, 12th, she will be trapped into early marriage. So dropping out of schools was one of the primary prongs of, containing the early marriage issues, so that she's educated, she moves out probably into her career and employment and the economic empowerment that she has to make her own decisions. That's a huge thing in itself. As we speak today, 15 to 19 years, that is where the secrecy is there. Many times they'll manipulate the age also and then get them into marriage. So when the body, mind is still under the phase of development, neither physically nor mentally, they are prepared to get into either marriage or childbirth. So the contraception again is not in the forefront. The unmet need for contraception is huge. And that's why we have as many as 15 million unintended pregnancies as it is in our country. So early marriage, early pregnancies, and if they get pregnant and it's unintended, or they get sequentially pregnant at 15, 17 years and the second pregnancy is aborted, and septic abortions and loss of lives. The teenage pregnancies, which is a very, very special category in our branch, where the pregnancy complications and the risks of becoming a case of high blood pressure and a case of obstructed labor and the trauma and the the childbirth complications and loss of lives. So COVID has really jolted and made us wake up to the situation even more aggressively than ever before. So this is the second best chance that we're having. So let's get at it, is what I would say.
What do you do with in rural areas where education is less, mothers are not literate, and so do you have any program for them also where you can probably coax them to have this vaccine?
Actually, we want to just the line between rural, urban, which we have always talking, that really it's time to blur that now. Anywhere, everywhere, every time girl, women goes for care, this is non-negotiable. This has to be as uniform as possible, and either the government or the public-private partnership or the private partners in collaboration with some NGOs will have to move the needle forward. It is our responsibility, otherwise we are failing our girls and women, Mr. Shankar, because if we wait forever and forever for things to happen on their own, obviously it will not happen. We have to think out of the box and make it happen. And for that, you will be alarmed to find out so-called educated, so-called affordable, they can access it. Still, about more than 70% in the urban areas have also not taken the HPV vaccine. The gap is huge. So you ramp up from one side and then many testimonials, yes, these are taking, it is safe, it is good, etc., etc. Then even that buzz will percolate onto the less accessible areas. And if we position this as something which is really, really important for our girls and women, I think there will be many more initiatives that need to come to the forefront to cover the areas which are generally deemed to be not accessible and affordable. We have to reach out to them and make things happen.
COVID left a lot of adolescents orphaned. How do you look at their future, especially the girls?
Again, this is a social factor which will definitely impact a pocket of the generation next. But coming to think of the reality, the parents in the COVID era were also so stressed that even if the adolescent girls had the parents, the parents couldn't overcome their own stress and handle some delicate problems with the adolescents. That also we have seen. So adolescents themselves, at least in the urban areas, and because of the social media, the YouDost, and there are many other platforms available in an anonymous and a confidential manner, the numbers have escalated massively, which means that they need help. That is for sure. And the mental health problems and challenges have really escalated, and we cannot still match the supply and demand, because the supply side of who would counsel them, how it will be appropriate, how it will be culturally relevant, and how it will get them to be in a better state of mind and body is still a huge challenge, because the workforce for reaching the adolescents with respect to all of these, even adolescents with the parents, the capacity building of this workforce to deliver some quality care to the adolescent population is a must, and we don't have a structured kind of a module developed for that. But the adolescents without parents, usually it is more the extended family structure which comes to the rescue, rather than a professional medical organization or we as doctors. And I would think it is just lip sympathy, because we really can't get in there and do more, because it is like out of the purview. And maybe one-off anecdotal case, we may have helped them to connect with somewhere that they can be taken care of and placed. But it is it is a anecdotal and individual kind of experience. But as a community, yes, there is much talk about it, but where it has landed the orphaned adolescent is something that each one of them, because it is so bizarre, and it is it is a touch point which is very complex and emotionally very disturbing. But we really have to think that God is there to take care. That's the kind of a situation that we've landed up in.
There is now global data indicating high levels of psychological distress among postpartum mothers during the pandemic. The rate of anxiety and depression almost doubled compared to non-COVID times. In Karnataka alone, there was this unfortunate suicide of the granddaughter of a famous politician. Now, what are your views, or what do you suggest in this?
I think postpartum depression, again, by itself is a very important issue in the women's healthcare space, which even in the pre-COVID era, I come back to the same sentence, that it was pushed under the carpet. Many clinicians did not have the bandwidth to even recognize it and do something about it, and each one was left to themselves. We had tied up with the NIMHANS to do a study, because the postnatal depression scores, as we call it, it's called the Edinburgh score. The questions did not relate to our mothers at all. I mean, if they were made to answer that score sheet, you wouldn't have gathered anything from there. So the NIMHANS team worked towards this special issue and brought out an Indian system of actually calibrating the depression scores for postnatal women, which we have to do for every single postnatal case. That means 30 million such forms should have been filled ideally, but the doctors group who are aware of this or who pay attention to this, etc., was dismal. But the post-COVID has brought this again as a very important issue. Now, when we speak of women's health, mental health is definitely now, included. And as we speak, the Poshan Abhiyan from the government has brought out a nutritional assessment card for the pre-pregnancy, pregnancy, and post-pregnancy. Now, Mr. Shankar, they have added in the nutritional assessment the mental assessment as well. So it has come in the government card. That means They have been sensitized enough. They've paid attention to this. The policy has changed towards paying attention and doing something about the mental health. Again, I have to underline and underscore the issue of the quality. Yes, the recognition is there. That's the first step. It has come into the card, yes, and the private also has been sensitized. But still, there is a lot more for us to do, because who is doing it, how they're doing it, is talking about it enough. What is the short-term and the long-term care that needs to be given? And overall, mental health and anxiety, both in pregnancy and postpartum in the COVID times, has been really, really challenging for us as clinicians, because so many questions asked during pregnancy also for which we didn't have any answers. Whether my child will be growth restricted, whether they'll be malformed, can I breastfeed or not. There was a phase where we didn't have the recommendations or the directives from the government as to what we should be telling, what not, etc., because it was all in a confusing phase. And you can quite imagine the anxiety of the to-be parents in that phase, where nothing was known to them and nothing was known to us either. So we've churned this issue in such a manner that now everybody has recognized that when we say the definition of wellness or health as being both physical and mental health, until today, until the post-COVID era, I do not think that the phrase of mental health wellness was taken seriously. And now we have just started paying attention to it. But at least something has to begin somewhere. So this has begun. Many have included it into a standard of care, kind of the respectful care and the mental health and well-being during pregnancy and postpartum. Postpartum depression is indeed a huge issue, and it's leading to catastrophic, endpoints where abandoning the child or abandoning her own life, etc., has brought it to the forefront. With one example from one family, as you said, to many others. So there is I think the post-COVID era has at least allowed us to loudly and clearly voice out our concerns on these matters, and everything would take time, but I think in another 5 to 10 years, it'll be a norm, like how you assess the weight, height, BMI, etc. The mental health scores also will be put down. HPV vaccination also will come. All these should become the standard of care, and it would be the standard of care sooner than later, because these were some issues which we have been struggling since the past decade and a half. But now acceleration is happening because of COVID. So I should really be thankful for that situation, which has made us all run faster than ever before. So that's a good thing.
Now, I'll come to another issue. There are reports that infertility is growing, especially in the urban areas due to lifestyle issues, obesity. And in our last episode also, one senior doctor had said that long COVID can even affect the quality of sperms. So how far is infertility becoming a huge problem, especially among the young population?
The young population is not getting married on time and conceiving on time. So the infertility is also a special bracket for the 35 plus who are into their careers, and the women are at least a small subset of them are empowered to decision make as to when they want to go in for a pregnancy. So that is fairly a significant bracket in the urban areas at least. Then there are many mushrooming centers where it's put up as a fertility center. So any young couple who thinks that they need to fast track their conception, even though they can conceive naturally, they'll rush to these centers and labeled as infertility, because once they go in there, they will get onto a bracket of treatment, at least the preliminary assessment, etc., because the mother-in-laws of the world are pressurizing them to get in quick to the reproductive phase as such. And the stress factor, I would think, is huge. And even the timed planned relations or intercourse, which we say during the ovulation time, that's been a huge challenge, and movies like Good News, etc., has brought that into the forefront. And so the reasons for recognizing that the infertility cases are the increasing is also because the Asian population, the ovarian aging is earlier than the rest of the world. Originally 50 years back, we had all our mothers in the age of 20, 22, 25, where we didn't even recognize that by 30 or 32, potentially because she's an Asian ethnicity, she can have an ovary which is aging very fast and may not have the potential to fertilize. So this is coming out as a premature ovarian insufficiency is a huge chunk, which scientifically speaking is also the reason for enhanced numbers of infertility. And of course, the more data we have, we will know the actual trends beyond the perception that everybody has, and we will know the real reasons, and we will figure out a way to combat.